Okay, you guys all ready to roll?
We are ready to go.
Okay, great. Good morning again, everyone. Good morning. Thank you, Sylvia. Thank you for responding. Good morning again, everyone. Ah, wonderful. Did you all manage to get the appropriate level of caffeination in place thanks to Aetna on the coffee break? Can I get a round of applause for our coffee break sponsor again, Aetna? Thank you. And some nice healthy fruit kebabs as well. That was great. That was great. Okay, so welcome back. We've got another couple of fantastic presentations lined up. We're going to start off with a panel discussion. You can see we've got a full house up here at the front. They're all going to be sharing some of their experiences, some of their advice, some tips and tricks for us to talk about their topic, which is the empowered parent. So we're going to ask everyone, please, to come on in quickly, find your seats. We've got a lot to cover and we want to get started. So I'm going to introduce the moderator of the panel, and she is then, when I turn it over to her, going to introduce the rest of the panel to you. So I'm going to start off. Actually, can I get someone to close the doors at the back, please? Thank you. Excellent. Thank you very much. Okay, so we're going to kick off the next segment with a panel discussion looking at the empowered parent. I'm sure that there are a lot of people in the room who are parents, grandparents, aunts and uncles, and I think that what we're going to hear from this panel is really going to hit home for all of us in one way or another. So I'm really excited to hear what they're going to share with us this morning. The moderator of the panel is Shannon Seymour, who is the founding director of the Wellness Center, one of our sponsors. Thank you to the Wellness Center for being a sponsor. They've been on board with us for years now. Shannon is licensed with the Council for Professions Allied with Medicine and the Health Practice Commission in the Cayman Islands here. She earned a bachelor's degree honors in psychology and a master's degree in clinical psychology from the University of Regina in Saskatchewan, Canada. While pursuing her studies, Shannon became the first ever Canadian recipient of the prestigious graduate student grant from the American Psychological Association Society for the Psychological Study of Social Issues. Shannon has a passion for community and frequently advocates for the rights of individuals and families living with mental illness and special needs. Shannon is a member of the Canadian Psychological Association and the Canadian Counseling and Psychotherapy Association. Her clinical career has spanned 20 years across Canada and the Cayman Islands, where she's worked for organizations such as Family Services Canada, Health Services Canada, and the Cayman Islands government. And in 2004, she opened the doors to the Wellness Center Limited. Ladies and gentlemen, please welcome our panel moderator, Shannon Seymour.
Thank you, Jennifer. Welcome, everybody. This is an exciting topic. This is a fantastic conference, so we're always proud to be a sponsor. Somebody said this was the 9th year. I think we've been a sponsor for about 6 or 7 years, and every year it just gets more exciting. I'm super excited because I'm always pushing for more mental health, more child and adolescent topics, and so we're not even at lunchtime on Friday, and we've already heard about lots of those topics. So that makes me a very happy healthcare conference participant. We're facing some challenges in our community with the growing population Dr. Lockhart spoke about this morning. And I think with that comes the need to talk about how we empower parents even more so. So children are accessing healthcare, and how do we make sure that the needs of them, their families, and their parents are adequately managed. So, I have to do this. So why do we talk about parents at a healthcare conference? I've been coming for many years, and we often talk about it as a side topic, but to have a panel of parents on the main stage, front and center on day one, is pretty impressive. And I think it speaks to the importance of parents' roles in pediatric healthcare, and it certainly is aligned and fits brilliantly with this topic of the empowered parent, the empowered patient. So we can't talk about empowerment of patients in the healthcare system unless we're talking about parents. Last night at the keynote, if any of you missed it, it was wonderful. We heard Dr. Batros and Dr. Sabal say that an empowered patient is an asset to the healthcare system. And anybody who works in pediatrics understands that profoundly. In my role in psychology, I work with families with mental illness, behavioral disorders, developmental delays, and there's nothing more important than having that parent as part of the team. When that parent is on the team, then amazing things can happen for that child. And I'm going to introduce the panel, but we're just going to do this brief intro first, so somebody mentioned this last night, but the World Health Organization defines empowerment as a process through which people gain greater control over decisions and actions affecting their health care. And although empowerment's sort of become a bit of a buzzword, we read about it a lot in medical literature. If we look at that, the World Health Organization actually defined it 20 years ago. So this is not a new concept, but it may be something that we are finally starting to come on board with as healthcare professionals. So rather than us as the experts telling people what to do, it's recognizing that we are in this together. So the principles of empowerment, I like it in a circular motion. I've seen it graphed lots of different ways, but to me a circle is never ending. And empowerment really is not a destination. It's not that thing which we become. It's not static. It's certainly not linear or binary. It's a process that's constantly changing. And so we can look at the principles of empowerment. We see things like information. We see making sure that parents have the literacy and the language, that they understand their child's condition. We want to make sure that they are participating, and with parents that means participating at a level in which they are comfortable. Different parents want to be involved in different ways. Some parents want to know what you think, and they want help in making the decision. Other parents want more information, and they want to be a bigger part of that decision-making process. So there's no one right way to empower a parent. It's about making sure that we're in constant communication with them. Another principle empowerment are things like shared decision-making, respect for one another, self-efficiency, making sure that they understand what they can do and how to do it. We spend a lot of time in psychology anyways, teaching and guiding and showing parents how to with their children so that they can see the outcomes and the benefits of intervention. So this idea of empowerment as a circular idea, something that is constantly changing, and we may come right back around to the beginning. We might do a great job of informing a parent and making sure that they understand a condition or a diagnosis, and then things change in the progression of that condition, and we have to start all over again. So it's not something as healthcare providers that we do once and then we're finished with. This is an important thing I would just want to briefly touch on. Last night, we heard about fear and loss of control as something that is prominent in anybody facing any kind of healthcare issue, healthcare problem, a crisis of their health. And fear disempowers. I don't know how many of you have ever had a kid that had an illness or a condition for which you knew nothing about and you could not fix it. That is an extremely powerless position to be in, and that evokes tons of fear in parents. As a parent myself, I've sat in those shoes. And as a healthcare provider, I often sit with families that are embarking on a journey for which they know nothing about, for which they cannot fix, nor do they control. And so that is an incredible, I think we need to pause and really recognize the fear that underlies a lot of why we need to empower parents. And I worry all the time anyways. I worry about kids on buses, I worry about kids riding their bikes, I worry about kids eating healthy, I worry about what time they're going to sleep, I worry about do they have friends, are they getting good grades, do people like them? So I imagine waking up and you have all of the regular things that we typically worry about as parents, and now on top of that we have to worry about their health. That was for my last little bit of talking. I'm forgetting to push the button. I heard this, one of the things that Dr. Lockhart left off his slide, which I'm sure he will add, is that we now have a brand new Cayman Islands Autism Society, which has been formed by a group of passionate parents who want to do just this. They want to empower and educate our community and advocate for the needs of their children. And we were at a meeting a couple of weeks ago, and one of the parents and founding board members quoted a study that had been done at the University of Wisconsin in Madison, where they looked at the cortisol and the stress hormone levels of parents who are parenting children with chronic conditions for which there are often a significant amount of behavioral difficulties. And what they found is that those parents had cortisol levels and adrenal systems akin to soldiers returning from war. And so when you've got that parent in front of you and you're rambling off the things that they should be doing and why aren't they doing and what's the problem, you have to keep this in mind. Because in addition to taking care of this child that's unwell or living with a chronic condition or a developmental delay, they're also raising other children, they're holding down busy jobs, they're paying mortgages, like somebody said last night, and they're taking care of everything else that they have to do. So why is parent involvement important? It doesn't matter what medical condition we look at. It could be obesity, it could be asthma, heart disease, diabetes, cancer, autism, ADHD, mental illness, anything. If we look at the research, we see that parents being involved, parents coming to the table, participating in the decision-making, in the management of that condition, improves outcomes for that child. And so what I love about this talk, which I think is brilliant, and I think we need to give the organizing committee a great deal of credit, is that they've taken this idea of the empowered parent and they're not putting somebody like me up here to talk about it for an hour. I could talk about it. I could talk about it as in my own life and hypothetically in the work that I do. But what they've done with this panel, and the decision to do this panel I think is pretty remarkable, is that they've sort of decided to walk the walk. And they've decided to take this concept of empowerment and really give the microphone to those who are walking this journey, to those who are living this every day and have lived this and will continue to live this. And so I think it's amazing that we've invited a group of parents and some amazing pediatricians who are also parents to be with us today. And so without further ado, how we're going to do this is I'm going to introduce each of the panelists. They're going to speak to you and share their experiences. And then at the end, once everybody's had a chance to talk, we'll take some questions and answers. So I know if you're like me, you've got a great question in the middle of somebody's chat and then you forget it by the end. So whisper it to a neighbor or write it down on a piece of paper, because we're not going to take questions until everybody's had a chance to speak. We want to make sure everybody has an opportunity to share their story. So let me get started. This is Miss Annikki Rose. She is the mother of 3. Casey, 17, Joshua, 12, and Naomi is 8. Most of you may know her as the wife of Cabinet Secretary Mr. Samuel Rose, but Annikki is a global general counsel of Harney's fiduciary and has many years of experience in the Cayman Islands financial services industry. She is a member of many associations, both locally and internationally, and has contributed a significant amount of her time to community affairs and pro bono work. She often speaks at local establishments, empowering youth and educating the community about type 1 diabetes. Being a mother of 3 and working at a global level can be quite challenging. Nonetheless, Annikki seems to have mastered time management, enjoys a healthy work-life balance. She enjoys reading, quality time with her family, and especially her vacations off island, she says. Get away from the work phone. And in the eyes of her family, she's seen as a super mom. And I'm sure after you hear her speak, you'll agree with them. So ladies and gentlemen, Mrs. Annikki Rose.
No pressure. When I was asked to participate, I immediately said yes, because this topic is so close to my heart, in fact, our lives. I always say that context is everything, and I would like everyone here to bear at the forefront of their minds whilst we delve into discussions, that our views, the things that we're going to discuss with passion, have all been shaped and formed based on the tapestry of our own lives. And I think ultimately what I would like everyone, at least every parent of a child with a medical condition, to walk out here with today is the feeling of empowerment. I would like them to know that there are resources that you can rely on to get through whatever situation it is that you are facing, whether it's through educational resources, medical professionals or facilities, or just a network of parents that are going through something very similar. So I'll share a little bit about my context. As Shannon said, I have, I think his picture's up there, yeah. The little guy in the middle is who I'm talking about. His name is Joshua. And my pregnancy with him was what I think most people would call a perfect pregnancy. I enjoyed the pregnancy. I ate properly, I exercised. I remember I used to put sort of classical music on my tummy because it was supposed to help with his brain development. I read to him a lot, even at pregnancy stage. Lots of jurisprudential and legal literature. I was in law school at the time. And so I just tried to do everything right because he was the son that I've always wanted. And in my mind, he was going to be this perfect little baby boy. When he was born, there were no complications, good delivery, he breastfed. But during the time that I was weaning him, he was about 2.5 years old, I noticed that Joshua started, peeing in his Pampers a lot more than a normal child. And I got a bit worried. And I think Samuel and I relied on, people around us, friends, family, for support. And so we would, just in conversation, we would say, we noticed that Josh is peeing Pampers a little bit. What do you think about that? And, a lot of people were saying, well, that's normal. He's going through a growth spurt, all the typical sort of responses, pacifying us. But there was something in my gut that just, it wouldn't let me settle. A few weeks later, I was taking my sister to medical school in Jamaica. And I remember I was unpacking her clothes, and I got a frantic phone call from Samuel. He's in despair. And I was like, what's wrong? And he said, Annikki, Joshua has just been diagnosed with diabetes. I said, what are you talking about? How is that even possible, Samuel? Like, he doesn't even eat sugary things. What are you talking about? And I was just like, no, that's not true. I should have never come here. I should have never left my kid with you. And it's all the resentment that runs through a mother's veins. Like, how dare you call me? Anyway, I went through all of that very quickly. And when I heard the concern in his voice, I knew something was wrong, and I said, you get me back home. And I was on the next plane out. I rushed into the pediatric ward to find Joshua, who was 2.5 years old, strapped into a bed, because obviously he was moving around quite a bit. They were trying to do blood work and all the rest of it. They were still testing, and he's strapped into a bed. A nurse is trying to find a vein that she can't find. And so I look at his arm, and there's lots of little sticks, and there's cords and monitors and just things everywhere. I left him a few days ago. Like, I just left him, and he was fine. And so I, of course, listening to his screams and howls threw me into absolute despair. And as a mother, I was ready to take the world down. That was a very difficult time for us. And Samuel describes that diagnosis, or that feeling, as if someone had cast a death sentence on our family. Our whole lives stopped. Nothing else mattered. My career didn't matter. Samuel's career didn't matter. Nothing else in this world mattered. We just were so frozen in that moment. And I always say, nothing prepares you. As a parent, nothing prepares you for that moment when you have to hear that your child has any medical condition. Nothing prepares us. Fast forward 10 years later, what seemed like a mountain at that time in our lives now seems like a mustard seed. Mm-hmm. And I think, having used that opportunity to bond as husband and wife, as a family, not only our close family, but sort of the extended family as well, really helped us get through so much, so much. And Samuel and I very quickly realized that if we were going to have a fighting chance, we had to completely submerge ourselves in this beast. We needed to understand what we were up against in order for us to have a fighting chance. We couldn't rely on a third party, a doctor somewhere, you know, hopefully we'll get this in the Cayman Islands. Totally irrelevant, totally irrelevant. We know we had to own it, and so we did. And Joshua has, for many, many years, Joshua has been managing his own diabetes. We taught him from, I think, like the age of 4, you know, how to prick his fingers to draw his own blood. That was horrible for me. I hate needles. I know he hated needles, but we would sort of, you know, help encourage him. We would do little things on the computer and help him understand, help him prick oranges and all the rest of it, so he knows how to check his own sugar, he knows how to check his urine, he keeps his logs, and he's just very, very immersed in his disease. I would like to believe that Joshua is an empowered patient, but I recognize that he is an empowered patient because he had empowered parents. And I would definitely like us to, I mean, if time permits, for us to get into four things today. I think the first one for me will have to be being hands-on. As a parent, being hands-on, being present, and not replacing our presence in their lives with presents, gifts, because a lot of us do that. We're trying to compensate because we're too busy. The second thing I really would, you know, like us to get into is overcoming fears, like Shannon said. Fears and emotions that serve to paralyze us. We're so scared to be wrong that we'd rather not get involved in the fight. We have to get involved in the fight. And lastly, I would definitely like us to consider that if you are an empowered parent, you, at least in my mind, stand the best chance of being, you know, one of the best doctors that your child could possibly have, and being a team leader in their medical care. I'll leave you with that.
Hello? Okay, get back on. Thank you so much, Annikki. I made notes of all those things. That was amazing. We'll have lots of time for questions as soon as we're done, so we're going to go on to our next speaker, who is Sabrina Foster. Sabrina is a professional independent director serving on a wide range of alternative investment funds. Prior to her role as a professional director, she practiced as an attorney at law in the Cayman Islands for over 16 years and was a partner at the law firm Appleby. Sabrina is married to Woody Foster, and together they have 4 children, Julian, Serena, Joshua, and 10-year-old Charlie. Sabrina is the director of the Cayman Islands Cancer Society and regularly supports community events aimed at increasing understanding and raising funds for cancer research. And typically, about half the year you see her bald, because she'll often shave her head at Hannah's Heroes Shave Day. So ladies and gentlemen, Miss Sabrina Foster.
Thank you. Thank you, Shannon. Yes, I've shaved my head 3 times, so I've been known to have very crazy hair, kind of like what's going on today. Anyway, I'm really pleased to be here and have an opportunity to share our family's story. So if anyone knows me, they will know that I had the cleanest babies ever. I was one of those germaphobes who always wanted to make sure that my child had the most pristine surroundings and everything. So my little girl was 6 months old when all of a sudden she developed flu-like symptoms. Immediately I thought her 10-year-old brother had brought a flu or virus home. We contacted Dr. Abraham to say Charlie was a little bit poorly. She was off island. We ended up seeing Dr. Cridland. And by the time we got Charlie to the doctor, which was, I left her sleeping, and she seemed a little lethargic. She had a little bit of fever. By lunchtime, Charlie could barely keep her eyes open. Dr. Cridland immediately ran blood work, and Charlie also had some oozing from one of her breasts. And Dr. Cridland took a swab. It turned out that Charlie had Pseudomonas and a double mastitis. It was quite a mystery how the cleanest baby in the world would have this flesh-eating disease and this sudden, very serious bacterial infection. She was at home with a helper. We had no idea how this could have happened. Within hours, it was determined that Charlie needed a blood transfusion, and without a pediatric hematologist, she had to be air ambulanced to Miami. So fast forward about 6 or 7 hours later, we arrive at Miami Children's, where Charlie undergoes a blood transfusion. Now, at this point, they want to check they want to do a spinal tap to see what's going on with her bone marrow. It turns out that Charlie's bone marrow had completely shut down. We didn't know why. It was a bit of a mystery. How did this child contract Pseudomonas? How did this child have a breast infection? How did this child's bone marrow just go to sleep? Eventually, we never did get a diagnosis as to why her bone marrow shut down. But over time, we spent about 6 weeks at Miami Children's Hospital. Eventually, we returned home where she was receiving shots. Eventually, her red blood cells came back, her whites came back, but her neutrophils didn't come back. So she was getting a shot every 7 days, and we would do blood tests, and this many days, another blood test. And the doctors here and in Miami were monitoring how often to give her this shot. And this shot was like a boost of neutrophils. Anyway, things were going well, and the shots were getting farther and farther apart. Of course, lo and behold, one day, 1-year-old Charlie, this was just after her first birthday, she came down again with these flu-like symptoms. Immediately, we did not think the worst. We thought, of course, she's picked up a cold from her brother. That poor kid got blamed for everything. Anyway, once again, this time it was a little bit different. And the first time seemed super fast, but this time seemed way faster. Charlie just kind of got weaker and weaker, and she started to develop bruises. This is between going to bed and the next day. Of course, we took her immediately to the doctor, blood work. Her counts were incredibly low. Here we go again, this bloody Pseudomonas. How did this happen? Her bone marrow is shutting down again. Your child needs a blood transfusion. You need to be air ambulanced again. That's okay. We've been here. We know how it works. We got this. We show up at Miami Children's Hospital. They do the spinal tap again, but this time they tell us that, Mr. and Mrs. Foster, your daughter has acute lymphoblastic leukemia. Whew, okay. She's going to need, sorry, I said I was not gonna cry. She is, so she has ALL. Here's a super big binder with everything you need to know about ALL. Your daughter is scheduled for a port insertion in the morning where she will undergo her first round of chemotherapy. Do you have any questions? ALL? What the hell is that? Anyway, I called my mom. I knew it wasn't good, but I called my mom in tears. Charlie has ALL? Of course, that's when the family starts. What about St. Jude's? Why didn't you do this? Why don't you go here? It happened so fast. We did not have time to think about hospitals, and they basically said she has ALL. It's the most common form of childhood leukemia. The success rates are very high. We'll talk about the protocol in the morning. So over the course of, Charlie has her port insertion in the middle of her chest and her first round of chemo. Now you can see from her pictures, she is still the happiest person you will ever meet. She is pure joy, 100% joy. And even through all of her chemo, she remained the happiest, most energetic kid. Anyway, so first comes the education part, educating yourself on what it means to have a child with cancer. What is leukemia? Over the course of the next couple of weeks, there were all these subtests. Well, she has this type of cell, and because of her age, and because of this, and because of that, and because of the other thing, she's now in a high-risk category. Okay, she's in a high-risk category, so this will be her protocol. So there's this already prepared list of her roadmap for the next 3 years. We had a 10-year-old at home. He had to move in with my ex-husband, his dad. I had to relocate to Miami for 14 months, and my husband commuted to Miami every weekend. We had to set up house. I had to get a car. It was a lot. It was a lot at once. It was a lot trying to figure out what the diagnosis meant. It was hard. I had a breastfed child in Pampers that was barely on her feet. Because I was a partner at a law firm, I had a client-facing role, and the most important thing, she was on my insurance. So it's not like I could just say, well, time out, I'm just going to take this sabbatical, because no, I needed to keep working. I needed to figure out how are we going to keep the work front going, because I needed this insurance. So that was a challenge that we had to overcome, just making sure that I could find that balance. Of course, there is the treatment. Charlie's longest stint in the hospital was 22 days straight. We spent 2 Christmases in the hospital. During her cancer treatment, she ended up with a bone infection. She had 2 bouts of H1N1. She was a hot mess, but she smiled all the way through it. I'm pleased to say that she's in full remission. Yeah, thank you. So we had 14 months intensive treatment. Then we had 18 months commuting once a month for chemo and administering daily chemo at home. And then we had visits monthly for a year, every 3 months for a year, every 6 months for a year, and now we're on annual visits. Now we're thinking about things like, how will her organs fare in the future, having had all that chemotherapy at such a developmental age? We've got vaccinations. We chose not to give Charlie any more vaccinations after her diagnosis. That's another area of empowerment, of getting the information and just trying to make an assessment. We ended up deciding not to decide because it seemed like the only decision that we could make, and it's going to be something that we will revisit again in the future. In terms of empowerment, I would say that work helped empower me because they stood by me. I was able to take a less client-facing role. I was able to stay on the payroll, keep supervising a team. We had Skype calls with my bosses. And so my workplace was very supportive, and that's certainly one way we can help to empower parents, is to provide a supportive environment on the work front. Community-wise, it was funny. People always think, oh, she must be going through so much. I can't bother her. Oh my goodness, you need to bother people who are going through a crisis. There's a feeling of really being left in the cold. People don't want to bother you. Everyone checked on Woody. Woody, how's the baby? Woody, how's Sabrina? Woody, how's the baby? But yet I never got a call. It was, I think people didn't want to trouble me. So I think as a community, don't be afraid to reach out to people. They could really do with your support. In terms of strangers, doing nice random acts of kindness. During some of these big stints when Charlie was in the hospital, I had strangers washing my clothes. Remember I told you I was like a clean freak? Strangers washing my underwear. My God. Yes, there were strangers who came to take my dirty clothes and wash them for me. There were strangers who brought me food. There were strangers who watched my toddler while I was in the shower. Because remember, this kid was hooked up to cords and a drip and chemo in Pampers. And even though she was bald and smiling, she was rambunctious as ever. So we couldn't really keep our eyes off of her. She was still very much an active toddler. And what else? And then family. I mean, you talk about situations like this, bringing families closer together. You know, Woody and I made an awesome team, and we just had to work it out. We just had to work it out. I was the one that stayed with her. Again, she was breastfed. In fact, she ended up being breastfed until the age of 4 because she could not eat food. I know. If you need any lactation advice, call me. But because she was on chemo for so long, I just couldn't wean her. I didn't have the heart. But Anyway, I'm pleased to say that we're on the tail end of it now. Sometimes I feel a little bit guilty. This is my last point. Sometimes I feel guilty because, like, we have chosen to make her a poster child. She's on the cancer survivors wall at the hospital, and sometimes I query whether that's the right thing to do, because she's got scars, and she has her annual visits, and sometimes I'm not 100% sure that she knows exactly what she's been through. And bless her heart, a year ago, she chose to shave part of her head at the last minute of one of these shaves. And I kept saying to her, sweetheart, you have been there, you have the scars, like, you don't have to do any of that. But anyway, she's 10, she's comfortable so far, but sometimes I wonder if, you know, as she grows, she'll probably end up being an empowered patient just because of the choices that we have made for her. It's not to embarrass her, but it's to show the world that, you know, she's a thriving survivor. We've been to hell and back, but at least we have a story to share. Thank you.
Thank you, Sabrina. And I'm just going to share something. She spoke from her heart today. Because when we gathered out front just now, I said, so you know what you're going to say for your 5 minutes, right? She said, what? 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 I thought I was just answering questions. She's a genius. All right. Next, I have Praj Pargaonkar, who moved to the Cayman Islands in February 2017 from London in search of a better quality of family life and warmer weather. She juggles her time between being a mom to Arav, who is 3, and working full-time for an international law firm. It's a total coincidence that all 3 of these ladies are attorneys. She works for the firm Auger as an attorney in the investment fund practice. Arav was born in the UK, which meant Praj could take a full year for maternity leave. Little plug there. Any policy makers in the audience? Let's clap that. There's a few ministers in the audience. So when she was thinking about having to go back to work after a year, and it was gloomy London when the call came from the Cayman Islands, I think she was quite eager to accept. Despite the sunny surroundings, her chosen field of work is highly time-intensive and demanding by its nature, so there's always a constant push and pull trying to find the quality moments for her family. Praj's husband, Amal, is a senior advisor in the Cayman Islands Deputy Governor's team, and he takes on many of the day-to-day responsibilities of the household, and is the rock around which their family revolves. Ever since Arav's diagnosis of autism, they've worked hard to ensure that they devote as much time as possible to ensuring that his daily schedule, which includes school and multiple hours of therapy, runs smoothly as possible. Praj was born in India, grew up in the UK, while Amal was born and raised in India, but spent many of his adult years in Germany. Given the family's multicultural background, their goal is to give Arav as much exposure to his roots as well as to the different cultures in the world. And it is their goal, and they're going to do everything that they can in their power to make sure that Arav succeeds in a world that perhaps appears a little different to him than it does to the rest of us. So ladies and gentlemen, Praj.
Thank you, Shannon. What passes through your mind when someone says that your child has a developmental problem? Perhaps it's denial, perhaps it's anger or sadness that you've done something wrong. But for us, if I'm honest, and this may sound a little strange, it was actually relief. Relief that finally so many questions had been answered. Relief that finally our child would get the support that he so desperately needed and would need in the future. There had always been some signs, maybe not so discernible when he was a baby, but as he transitioned into being a toddler, the feedback that we kept getting was that here was a very clever and intelligent child who just didn't want to speak. And not only did he not want to speak, he didn't want to engage with the world. He was a solitary little soul, and he didn't have the means to communicate or to get his needs met. Of course, none of that was so obvious in the house, at home, because there was always someone who was 2 steps ahead of what he wanted. Someone would say, set a schedule, because that's how he'll learn what he wants and when he wants it. And maybe it's the different cultures, maybe it's the different languages that are being spoken at home. Maybe it's the various illnesses that he went through over a period of many months. Maybe his hearing has a problem. So it was with this and much more in the background that we made a drastic decision to move away from family, cross the Atlantic and come to the Cayman Islands, exchanging the greys of London for the sunshine here. And our theory was very simple. Maybe better weather, warmer weather, a simpler, cleaner lifestyle would help him be happier and maybe engage more with the world. So when I actually stepped into Dr. Watkins' clinic that morning in March last year, and one of her first reactions was that let's administer the MCHAT test, I instinctively knew that we were on the right path. And that night when my husband Amol and I discussed it, he too couldn't fault Dr. Watkins' reasoning. Despite everything that we had done, it was true. Arav didn't like eye contact. He did not engage spontaneously. He did not ask, even for food or water. Things moved quickly, and from there were a spate of surveys and questionnaires for us as parents to fill out and tests for Arav to go through. And soon we were sitting in Psychologist Dr. Day's office, and we had the words, "at severe risk of autism spectrum disorder," being said to us. And it was at that moment that we finally felt we had some control. We knew that we had much to learn about this new world, and we were prepared to throw ourselves into it. There were so many decisions to be made, and the stream of advice just kept intensifying. We count ourselves so lucky that we were here on the island where there are facilities available to support not only the children, but also the parents themselves. We'd never heard of the different therapies that were going to be a part of our daily lives. We read everything we could about the Early Start Denver model, ABA, speech therapy, occupational therapy. We attended training sessions and had parent coaching sessions. We observed the therapy sessions, and we did our best to put them into practice in our daily interactions with Arav. One thing was clear to us. Arav could not succeed if we did not take control of the circumstances ourselves. Unlike neurotypical children, he did not have the ability to simply imitate what was in front of him. Everything needed to be taught one small step at a time. First, it was eye contact, and oh, the joy when my 2.5-year-old first met that goal. It was indescribable. Then it was self-regulation, asking for help, independence. Everything has taken time, patience, and a lot of commitment, and the journey continues. We keep having to decide whether a new difficult behavior is, well, a 3-year-old being a 3-year-old, or something that needs specific support, formal support. Recently, the words "no" and "stop it" have featured a lot in his conversations, which is great, as he's showing his preferences and has a personality, but there may come a time when he needs to be taught who's in charge. Perhaps that's no different to normal parenting, so we'll wait and see. But for us, being an empowered parent means understanding what Arav's needs truly are and having the tools necessary to meet them, whether it's ourselves, through extended family, grandparents, helpers, nanny, or with additional formal support. It's working with the health professionals like Shannon to give Arav the best shot possible to have a happy, productive, sociable, engaged life, like the cheeky chappy that he really is.
Thank you so much. I just want to admit, Amal is right there in the audience, that dad that does everything. All right. Whew. Can we give them a round of applause, please? I don't know what kind of attorneys they are, but they're fantastic mothers. Now we're going to have Dr. Earl Robinson speak. He's a graduate of the University of the West Indies. He entered the field of pediatrics as a junior doctor in Barbados 28 years ago, before pursuing graduate studies and board certification in New York. He then returned to his native St. Lucia, where he served as consultant pediatrician and head of department at St. Jude Hospital, while also running a private practice. He relocated to the Cayman Islands, where he's employed at the Cayman Islands Health Service Authority as a consultant pediatrician and served as clinical head of department and chairman of the perinatal committee up until recently. He is married, father of 2 adult children. He says here that his interests are in sports. In his younger years, he played, but now he's relegated to the position of fan on the couch. Dr. Earl Robinson.
Thank you. Good morning to all. When I was asked to participate in this panel, I immediately agreed, because in the past I had been part of a panel here, but we were in a small room somewhere on the side. By the time I found out that we were going to be part of this big auditorium, it was too late to Anyway, I want to give more of a pediatrician view on this topic, parent empowerment. On the surface, it looks as if you're empowering parent to take over, like it's a transfer of power, but from the provider to the parent. But what we are really talking about is encouraging, equipping parents to be partners in the care of the child. So basically, it's parents taking greater control over aspects of the children's lives. Now, as I mentioned in terms of power struggle, are there going to be times of disagreement? Yes. If there are any married men here, you would know that as partners, there will be disagreement. Your answer to that will really depend on if your wife is sitting next to you. I want to do kind of 2 aspects of it, seeing parents as advocates and parents in their role as partners in the care and decision-making. I think as pediatricians and even primary care physicians as well, we can help parents, 1, understand the chronic illness or disability. As was mentioned earlier, sometimes when you get that diagnosis, your whole world changes, and there are going to be a lot of questions. And our role is really to be in that position where we can inform the parent to various resources, books, articles, and proper websites. As you know, there is a dearth of information out there, and sometimes too much information. And it's really for our role to really direct into decent and proper websites as far as information goes. Try to encourage, when available, being part of a support group. And with this knowledge about the illness, you'll find that parents are better able to know if the services the child are getting, if it's appropriate, and if it's adequate, even if more can be done. Secondly, knowing the key players involved. So whatever community you're in here in the Cayman Islands, especially with chronic illnesses, as I mentioned, when things go wrong or when you come up a roadblock, within the health organization, who can you turn to get some answers? When the health insurance are giving you roadblocks, who can you turn to try to get some answers? And so I think our role here is to try to direct as possible. Having the patient or the parent know their rights and responsibilities, and also to become well organized. With a chronic illness, there were going to be outpatient visits, and sometimes the patient will not turn up and say they forgot because the hospital did not call them. It is a role as a parent to be empowered, to get organized, keep a journal or diary, to keep even medical records, because sometimes you cannot explain it all when you probably see a new doctor. To write out questions, because many times you have the questions before you leave home. By the time you leave the doctor's office, you say, oh my, I was to ask this, I was to ask that. So we should encourage you to write out the questions, and also prepare your child for any medical appointments or procedures. Children do much better if you tell them up front what to expect when you go to the doctor's office, or if you've been admitted and you're going to be getting a procedure, to try to prepare your child, because yes, they may still cry, but just that preparation makes a big difference. Encourage parents to ask questions. You know, we are under time pressure. Sometimes I won't tell you what my time slots are in my clinic, but as you would imagine, you have a number of patients to see in X amount of time. And sometimes we find ourselves guilty of wanting to speed up things and move along. But we really should be asking parents, to encourage parents to really ask the questions, especially when you're dealing with chronic disabilities. Create an atmosphere for clear and effective communication. So at the end of the visit, sometimes it will be nice to have the parent just say back to you, what did they understand from all that you have told them? Because everything they can understand and nod their head as you go along. And then when you're ready to say it back, you realize, wait a minute, 3/4 of what you told me has gone already through the door, much less by the time you get home. So encourage that kind of atmosphere as a pediatrician. In terms of seeing the role as partners in the care and decision-making, as you heard that I entered pediatrics about 28 years ago. And at that time, it was more provider-oriented. I haven't gone to medical school, haven't gone through years of training. The feeling was that the doctors knows best in terms of making decisions on what is best for the child. The question is really, is it that the doctor knows best? The parent who has been spending months and years with the child, are they not the ones who will know best for their child? So that's a question to keep in mind. All right. So we should listen and respect that child and parent, honor the racial, ethnic, cultural, socioeconomic background, family experiences and dynamics. So a lot of times our own cultural bias, our own religious beliefs sometimes will bias us in how we approach. And we need to understand from the patient point of view what they're going through, where they are right now, and not be judgmental. Health organization should need to show some flexibility in policy, procedures, and practices. I need to put on a bulletproof vest right now. Policies and procedures are there for a reason. And some people say rules are meant to be broken. But there's a place for rules, there's a place for regulations. But there are some unique situations where sometimes we may have to bend a little bit. There should be sharing of complete, honest, and unbiased information. Sometimes we think that we know what we should give to to give to the patient in terms of information, and sometimes we hold back because we feel, oh, that's going to be too much, or they may have too many questions if I tell them so much. So we need to be very complete and honest in that. And parents to be actively involved in the hospital care, analgesia, anesthesia, procedures, home care, and preventive care. I found that especially in many health institutions, including mine, sometimes when it's ready to go to the operating room or do certain things, we have the parents go out of the room. There is a thinking now that children do much better when the parents actually participate in that. And I know, again, I have to put on a bulletproof vest for that. But in general, it will reduce anxiety and reduce emergency room visits and hospitalizations when the parents get involved. And we as pediatricians also must know how to resolve disagreement and conflict, because sometimes what we want for the child is not what the parent sees. And then we should be able to come to some kind of agreement and resolution as far as that is concerned. I have a message here that we are running out of time, so there was one or two personal experiences I would give, but we'll leave that for another time. Thank you.
Thank you, Dr. Robinson. Whoops. Okay, I just want to make sure that everybody gets a chance to speak. We've got 5 minutes, we're good. Dr. Sarah Watkins is a highly experienced neonatal and pediatric specialist with 25 years service as a consultant, following training in some of the UK's most foremost centers of excellence, including the world-renowned Great Ormond Street Children's Hospital. Prior to coming to Cayman, she was the chief of service at the University College London, a world-class tertiary center. She's qualified in everything and anything to do with pediatrics and neonatology. Can I just summarize you like that, Dr. Watkin? She's written books. She's amazing. She's the mother of 3 children, one of whom is on the autism spectrum. Dr. Watkin.
Thank you. I just wanted to start by thanking Elke, Sabrina, and Praj for speaking today. It's a very brave thing to do, and I think you learn so much more from them than actually you will learn from Earl or I. And also I'm very humbled, I think, as Earl is, to be a paediatrician and to share some of these journeys, not only of the 3 of you, but many other children throughout my 25, nearly 30 years now as a paediatrician. So when I thought about this phrase, the empowered parent, last night, the first thing that came to my mind was how much empowered parents benefit their child. But actually, empowered parents benefit the whole family. When parents are empowered, their mental health is improved, and I'll come back to that in a moment. But they also benefit the healthcare profession. It makes my job easier. And actually, particularly, I think back in my time in the UK, empowered parents make a real difference at a societal level to a very limited healthcare resource. So I wanted to share with you just for a moment a brief story about neonatal medicine, because I think it illustrates this point. As neonatal doctors and perhaps neonatal nurses looking after very sick, very preterm babies, we perhaps were rather elitist for many, many years, that only we could care for these very sick, very premature children. And then a doctor called Dr. Lee, who works in Mount Sinai in Toronto, introduced a very different type of care into his organization called Family Integrated Care. He believed that families, and particularly mothers, were the best people to look after their very premature babies. And these parents were taught how to nurse, not just care, but how to nurse for their babies, how to look at the baby's physical signs, how to say when their baby was unwell. These parents, so the first thing that happened was these babies did much better. The outcomes have been, it's been shown time and time again that you can prove the outcomes of these babies. But the parents went from people who lived in fear that their child wouldn't survive or fear that their child wouldn't develop normally, to people who felt in control, whose mental health was much, much better. And of course, the organization benefited. These babies actually went home earlier. And the health resource, the nurses and the doctors, could then use their time and energy for very specific problems to the children. So that's a sort of example from neonatal medicine. And I feel so, so passionate about empowering parents to look after their children. So the next thing that came through my mind last night was that empowerment's not a word. Sometimes it's banded around as a word, but actually it's a set of responsibilities, actions and behaviours, not just of parents, but of us as those of you in the room who are healthcare professionals, of us as healthcare professionals as well. And I'm going to share for one moment my story where I was disempowered as a parent. In England, I knew that my son had autism when he was 4. It took us 3 years to get through the sort of service that parents will get here in under 3 months. Every 9, 10 months later, you get your child seen, maybe wait another 6 months for a report. The only word I ever remember from that report was, I don't think it said this, but this is what I heard, bad parent. I was a bad parent at 4 because my child didn't behave themselves. But I had 2 perfectly behaved children, 2 children who knew how to behave, how to be sociable, that you didn't hit another child in school, those sorts of things. It took me to coming to Cayman to feel empowered about my own child's mental health. So then the final thought I thought about was, what's the role of a doctor and medical professionals empowering parents? And as Earl said, it can be very easy sometimes in a busy environment to just become a doctor who diagnoses and treats. But actually the most important role that we have got as healthcare professionals is to listen to parents, to recognise that parents know their child better than anybody else. And we need to listen to that, we need to respect those views, and we need to take every opportunity when we're seeing families to educate them. You can only be empowered through education and through good knowledge. So I'm going to stop there, if that's okay.
Thank you so much, Dr. Watkins. It's true. I think as a member of the healthcare community in this country, I'm incredibly proud. We do remarkable work here, regardless of what aspect of healthcare that you serve, and this conference, I think, is testament to that. I want to thank everybody who was brave and courageous to come up here. Not an easy thing to do. Unfortunately, we don't have any time for questions, even though I know you probably have tons of really good ones, but I'm sure if you catch them before they head back to the office or out for lunch, they'll be happy to chat with you. Oh, and Jennifer has a few announcements, so please don't leave.
Can I get another round of applause for this amazing panel? It is too bad that we don't have time for some Q&A, but I'm grateful to know that you guys will hang around a little bit so that people will have an opportunity to catch up with you. But I want to thank you all for sharing your stories and sharing your views, and I'm sure that it's touched everyone here this morning. So again, big round of applause for you all. Before I give the speakers gifts, I just want to recognize and welcome the Honourable Minister Julianne O'Connor-Connolly, who's the Minister of Education, Youth, Sports, Agriculture and Land. Thank you so much for joining us here this morning, Minister. So I do have a small token of our appreciation for your time and for your efforts sharing your story with us this morning, and they were generously sponsored by Kirk Freeport. Thank you very much. Purple for the girls. Okay, so purple is for the girls.
Gender specific.
And the blue is for the boy. Okay, thank you all very much. Is Annikki here? Okay. I'm going to let the panel filter off, and you can go. Yes, you don't. I'm not going to hold you hostage. Okay, because our next speaker, I hope, there she is. Annikki, come on up. All right. Okay, how's everyone doing? Everybody's holding on okay? I know we're getting closer to lunch. That's always a tricky, tricky time of the day. But I want to welcome up to the podium Miss Annikki Brown. Annikki is the country manager for Generali Worldwide, and she's going to be talking to us about empowering patients and the impact on the cost of healthcare. So Annikki began her work as a Cayman Islands attorney who moved into the insurance industry when she was hired by one of her former clients. She now operates as country manager and legal counsel to Generali Worldwide at their general agent International Healthcare Solutions in the Cayman Islands, and is an active member and previous deputy chair of the Health Insurance Standing Committee of the Cayman Islands Insurance Association. Working with Generali Worldwide introduced Annikki to what has become a passion of hers, wellness. And in pursuit of this passion, Annikki founded Annikki Brown Coaching, a professional coaching practice that provides life and leadership coaching. She partners with individuals, couples, and corporate clients to create a shift in their present life, supporting their well-being and having them get past their obstacles and step into an authentic and empowered reality of their own design. Her professional interests include health, wellness, coaching and personal development, leadership, insurance, legal, and labor affairs. It was with Generali Worldwide that Annikki found her life's work to create a world of wellness. The work of making the world well has taken her to the stage of TEDx and a number of conferences as a speaker and a contributor. Ladies and gentlemen, speaking on empowering patients and the impact on the cost of healthcare, please welcome Annikki Brown.
Thank you. Good morning. It's almost afternoon. Ladies and gentlemen, before I even start, I have to apologize for the sound of my voice. I've been battling the flu for over a week. However, just in case, don't worry, I have backup. I have been told that if I lose my voice halfway through this presentation, our marketing and wellness manager, Karen Ebanks, are you here? Please wave. She's going to stand up and complete my presentation by way of interpretive dance. And now I know you all are hoping that I fail. But it's always an opportunity to be a part of this conference, which I believe was the brainchild of Ms. Ahern and the Minister of Health in the past, Mr. Mark Scotland. And it would have started around 2010, which is when I actually moved into my own job in Generali Insurance. But what I'd like to talk to you today about is the evolution of the healthcare system, the healthcare ecosystem, as I like to call it. One of the things that I love about this system, as you can see, is that it's evolved kind of like a jungle. You know, welcome to the jungle is what we say to each other in health insurance sometimes. And you'll find that it's, rather than its evolution being dictated by biology, it's very much been a matter of human agreements. But before we actually get into the actual ecosystem that has the patient, the healthcare provider, the government, the employer, and the insurer as the main players, I'd like for you to take a look at the lenses through which I'd like you to see this. The first is to keep in mind that in the evolution of the healthcare ecosystem, one thing that has come about very clearly is that the human body is the king of the jungle. Right? The human body dominates all of what we think about and all of what we're working on within the healthcare ecosystem, the human being. The second thing to keep in mind as a lens through which to see this is that every single one of these roles, and you'll see, let me see if I can go back a bit. No. Every one of the roles that you'll see that is played within the healthcare ecosystem is played by a human being. We are all a part of a whole, but every single role is a human being making a decision. Sometimes that's forgotten, particularly when you're upset with your health insurer and you're on the phone. It's a person on the other side of the phone. And the third thing to keep in mind is that the entire healthcare ecosystem is based on a set of human agreements. Civilization is a human agreement. When you really think about it, we made all of this up. You know, this is all a creation of the human mind. But just like every other piece of civilization created by humanity, the healthcare system is based on our agreements. So let's take a look. We're going to go through each one of these roles and look at how it evolved in the creation of this ecosystem. And as expected, the first thing that we came across in this evolution was the patient, the human body. At the dawn of mankind, whether you believe that we were created or we evolved or we came to be in any other way, we can all agree that the medical ecosystem began with the human body. And the cycle went kind of like this. We were born, we ate and we grew. Those of us who survived long enough to mate created a next generation. We passed on knowledge, we experienced pain, we experienced discomfort, and then we died. The end. Very predictable cycle. It still happens. Take a look. But somewhere along the way, we actually decided, we made an agreement amongst each other. We decided that we do not enjoy discomfort, that we would prefer to avoid pain, and that we'd very much like to live longer. So our instinct for self-preservation gave rise to the first of the agreements in the healthcare ecosystem. And so we chose, and I think I might have killed it. Oh, there we go. We chose to create healers. You see, this is the first place where we split off. Our agreement was that some of us, some of the human beings in our community, would dedicate themselves and devote their lives to alleviating pain, averting discomfort, and delaying death as long as possible. So some of the earliest healers, and I'm sorry to disappoint the doctors, would have been midwives, all right? For as long as we have been popping out babies, there's been somebody there to catch them. There would have been older women who had borne many children, and even if they hadn't, they would have attended on the births of many, and that was what would have qualified them as a midwife. There is no record of civilization that does not have a midwife in it. The earliest known civilization, which was a civilization called Sumeria, existing in a place called Mesopotamia, kind of like in the Middle East type area. They speak of one of their gods, a goddess called Ninursag, who was a midwife to the gods. Yes, they're gods, huh? They bring human beings into the world. But as long as we've been having babies, there have been midwives. But there were others as well. You know, the doctors, they're pretty new on the scene compared, but back in the day, there would have been the individuals who studied plants and lives and human bodies. They would have been the spiritual leaders, the priests, the priestesses, the witches, the shamans, the knowledgeable people of those times that would have studied herbs and bodies and nature's gifts. And the experience of discomfort and pain would have been very mysterious to early man. connected to the cycles of nature, the moon, the whims of the gods, and faith would have been very much involved in their healing. Interesting that we're returning to that kind of thinking today. But oral histories and later on written records of the learning of those early healers would have been passed down from generation to generation, snowballing and growing into very ancient traditions that survive today, such as Ayurveda of India and Chinese medical practices. Even now, we're discovering some of the wisdom of the priests of Imhotep in Egypt and some of the pre-Mayan and Incan peoples of South America and scholars of Timbuktu. So healers would not have divided wellness or health into the 7 areas that we recognize today. The spiritual would have been seen as inseparable from the emotional and the physical. So they would have dealt with everything all at once together with whatever knowledge they had at the time. So now we had a body of knowledge at this point in time in the evolution of the ecosystem that was a mix of spirit and science developing in every part of the world that was designed to explain and alleviate pain and discomfort and to do as much as possible to delay death. Then came modern Western medicine, and we're going to stick to the Western traditions just because that's where we are. In 420 BC, Hippocrates determined that diseases had natural as opposed to supernatural causes, and he took the guiding hand of Western medicine out of the temple and into the hands of science. In the centuries that followed, the Greeks, the Romans, much of the Islamic world studied and documented their findings, learning more and more about the human body and its interaction with the world. And then in 400 AD, the first hospital was created in ancient Christendom, in Latin Christendom. And about 650 years later, God bless Britain, England obtained her first hospital. Took her almost half a millennium. But study snowballed and picked up momentum in the 1800s with discoveries such as anesthesia and vaccination. Smallpox would have been the scourge that they were looking at initially when they were looking at vaccination. And it was very brutal at the time. They used like a piece of string. They'd cut your arm into like crosses and then run a piece of string through a pox blister and then run it through your arm. So thank God we live in this time. You know, not everyone survived those early inoculations. But our medical knowledge really skyrocketed in the 1900s with groundbreaking discoveries such as the blood type, penicillin, CPR, and insulin. So the earliest agreement that we made with healers has really paid off in the thousands of years that human beings have existed. So every year we learn more about preventing and alleviating pain and suffering, and every year we find more ways to live longer. Then came another player, the government. As we grew to know more about how to heal, we also learned more about how to harm. Governments are still very hard-pressed to protect the public and create and regulate standards of practice. Government regulation continues to develop to protect the human body from exploitation by those who are more hungry for knowledge and profit than they are for healing. Medicine has had very, very dark and brutal days where knowledge and profit became a higher priority than well-being. And some of these examples are found in poisoners and body snatching, kidnapping and murder. Just to name a few of the evils, they created a need for limits and boundaries, defined ethical standards, and the protection of law. If you ever visit Edinburgh, I don't know how many of you, any Scots in the room? You ever visit Edinburgh, you can actually take the body snatcher tour of the entire city and just see for yourself how a shortage for cadavers at one of the top medical schools in Western history, they had a shortage, and they went to creative ends to find bodies to operate on and to actually teach medical students, and it actually resorted beyond body snatching to actual fresh bodies and murder. But while some of these threats have faded out of recent memory, there are more contemporary versions of ways in which human beings have used medicine and medical knowledge to harm each other. Within the last century, when Nazi Germany conducted barbaric, involuntary human experiments on twins and minorities and other peoples, and colonial powers, and this is not as widely known, but colonial powers and pharmaceutical companies conducted human experiment all over the continent of Africa up until the 1990s. We can remember this time. This is today. Even more recently, scary horror stories of the human organ black market have popped up all over the press, all over the world. But fortunately, in Cayman, we have much more pedestrian concerns, things like, insurance fraud maybe, negligence here and there, and the occasional malpractice claim. So thank you for our medical community for staying out of that dark territory. But in light of the potential for atrocity, humanity made another agreement with an entity called the government. Now, government would have evolved along with medical knowledge, playing a very great part in the creation of civilization. And in fact, some may even say that civilization equals government. I mean, you can see whether or not you believe that based on how governments are operating today. But human beings made agreements that some would lead us, some would make decisions on behalf of our collective communities, and would determine how to face down the threats of human life. As medicine began to prove itself to be potentially dangerous, governments stepped in to regulate, some very effectively, some not so much. Laws, which are actually written down and binding agreements, were made by representatives of the people who were made to regulate how medical care would be delivered. So lawmakers created barriers to entry into the profession. So you can't just rock up and hang up a shingle and say, I'm Dr. So-and-so. Now you need to qualify to be a medical professional or of any format. Nursing, you have to go to school for a certain number of years. From the scrub tech to the transplant surgeon, you need to qualify in order to call yourself one of these professional titles. That is as a result of the decisions that were made by governments. Various qualifications need to be met, and in some cases, rituals need to be observed and certain oaths taken. And some of you might remember this name from earlier on in my conversation with you. Mr. Hippocrates himself was responsible for what we now call the Hippocratic Oath. Okay? So today, both medicine and government and its laws have evolved into very complex, hugely complex structures with many, many moving parts. As a result of different agreements, different systems have cropped up all over the world in different countries, with very few of these ecosystems looking anything alike. In Cayman, our government has created laws such as the health practice law, the health insurance law, which I'm going to get into in a minute, as you can imagine, the pharmacy law, and our government has also created regulatory and participant bodies, such as the Ministry of Health, the Health Services Authority, SINICO, the Health Practice Commission, our regulators, and Health Insurance Commission, also our regulators. As government has developed, so has healthcare. Healthcare has taken off under these structures. Within these structures, it seems to have created quite a lot of freedom. Technology and pharmaceuticals have replaced some of the rudimentary tools of ancient traditions and the herbal garden. Mandatory periods of study now go into qualifying a healer from every level, as we've already taken a look at. And this can range from 6 months to qualify, say, a scrub tech, to 25 years, depending on the level of practice of the physician. Allied professions have also shown up, so now we have various versions of therapy. There's so many different types of contributors to the body of medical knowledge. And health, once narrowed by Hippocrates down to physical soundness, has now expanded once again to include mental, emotional, and even spiritual health. So this development and this expansion of the remit of health and the high standards of protection have led to the rising cost of healthcare. You don't want to have to be responsible for paying for 25 years of study. When you really think about that, that's what your medical bills are coming back down to. The level of qualification that it takes does have a major impact on what you're paying as a healthcare consumer. And rightfully so, you would expect that there would be some reward for the type of work that goes into being a qualified practitioner. But also having a huge impact on the cost of healthcare is what appears to be a bottomless and constantly growing demand for the alleviation of pain, the avoidance of discomfort, and the delay of death, which is met by a limited, exhaustible supply of material and manpower. When you look back to the generations of our grandparents and the kind of discomfort that they would have experienced in their own life, without even thinking about it, you know that you would be running to your doctor today instead. Enter the employer. Labor revolutions and uprisings throughout the world not only resulted in the freedoms that we now enjoy in modern Western civilization, but also in the legal requirements, particularly in the Cayman Islands, that the employer support the employee in covering their healthcare costs. In some countries, this is not mandatory, but in Cayman it is, and it has been for many years. And this has actually created a very successful and thriving healthcare ecosystem. But many employers take responsibility very seriously. Not only do they contribute to the cost of your health insurance, but many of them have extended this to providing wellness services, to making sure that their kitchen is stocked with healthy foods. They really pay close attention to their company culture, and they participate in programs such as the EAP. So a lot of employers have taken the responsibility for the employees that spend time in their space, so much time in their space, very, very seriously. And then came the baby of this ecosystem, the most recently evolved, which is the health insurer. Now, in the 1860s in the United States, a new idea surfaced about how to tackle the rising cost of healthcare. This is not a new problem. As healthcare continued to develop, we went from paying 50 pounds or 50 pence to thousands of dollars for our healthcare. This has been going on for a long time. Insurance, though, in some other form, had been used up until this point for many centuries to protect against the loss of cargoes, of inventories, of property. There were discussions around insuring the ships that came to the New World. That's how old this concept is. But it hadn't been applied to health, hadn't even been conceived as a possible protection against the high cost of medical care for the individual seeking to avoid discomfort, alleviate pain, or delay death. But in 1866, a solution was concocted that was still very, very narrow in its focus. Employers began to take out accident insurance for their employees. Not the health insurance that we currently know, but more, it would be much more like your employer's insurance right now around, you know, what's it called? Workman's comp. Yes, there we go, workman's comp. I'm sorry, the memory isn't that great either, nor is the hearing. But the idea really caught on in the early 1900s, and I think the first was in 1911, and it was extended bit by bit over the next 100 years to cover catastrophic illness, and then hospitalization, emergencies, surgeries, and then more recently, and I think this would be in the last 50 years or so, extended to things like primary care, wellness, preventative care, and now in the last 20 years or so, to extend beyond the physical to the mental health and the treatment for mental illness. So our role has evolved significantly, along with, even in the short time that we've been in existence, beyond just the way that insurance was initially designed to be seen as. So initially, insurance would have been seen as a financial instrument that was designed to protect against financial loss. It's still what it is in our basic contracts. It really is still a financial instrument. But the individual agreed with the health insurer to participate in the financial pooling of their premiums to pay their medical bills. Then employers began to sponsor the participation of their employees in these policies. To this day, that's why we call employers plan sponsors. We are sponsoring as employers, and you notice I said we there, you can see the interrelationship. We're sponsoring as employers the participation of our employee in our chosen healthcare plan. So this agreement resulted in the individual being able to rely on their policy, whether or not they had money in their pocket when a disaster, a medical illness, or a catastrophe struck. They could go to their doctor, and the insurance company would pay for their care, as long as they were up to date with their periodic payments. In Cayman, our periodic payments are every month. But with the entrance of the insurer, the medical profession really began to benefit. So as you can imagine, if you're dealing only with an individual coming in to pay out of their pocket, there would be times when the sick person was not able to pay. So they found that there was a bit of reprieve from the fear of not being able to be paid for their services rendered to individuals. And the insurance company began to provide some financial security and a guaranteed and predictable type of income to the medical professional. This, in turn, would have freed up the medical industry to further develop itself, And in many ways, I think it's no coincidence that we have skyrocketed in medical knowledge in the last 100 years, along with the growth of the health insurance company. However, the honeymoon did not last. Many instances of abuse arose on both sides of that relationship, very new relationship, souring the relationship between insurer and medical provider. Whole insurance companies, and the insurers in the room know this history, whole insurance companies have fallen to bankruptcy due to questionable billing practices of just a few medical professionals. On the other side of the conversation, medical professionals developed a certain amount of distrust for what they began to see as high-handed decision-making of persons unqualified to question their professional judgment. All of this sounds very familiar. You've probably had conversations with either your insurer or your medical professional that points to this conflict. And so, while governments were just getting involved in the regulation of the medical professional, they ended up also wading into the conflicts between the medical professional and the insurer. To this day, when we see this happen, the role that is played by the role that's played in our ecosystem by the government is actually taken over by the Health Insurance Commission, and they do a very good job with the resources that they do have in getting in the way of those conflicts. So today, we have a fascinating role to play in the Cayman ecosystem. But insurers have learned that after many years of tangling with the medical practitioners, in order to make sound decisions on the financing of medical matters, we would need to employ a certain amount of diplomacy and strategy, and we would also have to hire expertise that we did not have. Two major developments came out of this realization. One was the medical network. Insurers began to court the medical profession, giving preferential treatment to medical providers that would agree to treating our clients within certain standards. In order to become a part of a medical network, there are certain standards, even today, that they need to meet in order for the insurer to trust the medical provider enough to steer volume of their insured clients into the care of that provider. These standards begin with adherence to accepted medical standards, medical practice standards, and they end with agreed billing processes and agreed discounted fees. In creating these networks, the insurer is minded to protect the patient body, the human body, number one, king of the jungle, first, and the policy second. The second development that came out of the years of tangling was case management. The insurer learned from early growing pains in the health insurance that medical and nursing expertise would be vital in their role as a patient's financial advocate, because that's what we end up being in many cases. Medical professionals from diverse backgrounds have been hired by almost every insurer, I think, in the Cayman Islands, and most of them around the world, to create teams of case managers. Today, there's actually a separate case management qualification. You can go to school and study to be a case manager. But these teams are still, the majority of them are still headed up by a medical director, and they still have nurses and other doctors on their teams. So now, claims that come into a health insurance company that are in any way suspect, and sometimes they are, I'm getting to that in a second, can be assessed by peers in the medical profession and tested against accepted standards of medical practice. So our case managers, our case management team, what they do today is that they support in accessing emergency care, routine care, planned tertiary care, care overseas. They steer patients who are traveling overseas into our network to make sure that they are cared for at the standard that we expect and that we have negotiated for our Cayman clients. They also conduct pre-authorizations, which is where we kind of get the most pushback, but we're going to get into that in a second. And they coordinate admissions, they monitor your treatments, they make sure that when you go to Cuba, you're not kept in the hospital for a full year for a broken leg just because you have $1 million lifetime maximum. They support your patient and your family. They balance patient care with the managing of costs, patient care being the primary concern. And they also make decisions with respect, and this is very important for us who live on an island, with respect to evacuation versus local treatment. In particular, pre-authorization is the place where we get the most pushback, as you can imagine. This is where we actually actively question or seek proof of the professional judgment of the treating physician. The process is designed to determine medical necessity. That is the overarching purpose of pre-authorization. But what we are doing is double-checking the decision of the medical professional as it relates to the most invasive, the most dangerous, and the most expensive and therefore profitable types of care where the patient and or policy can be abused. We ask the doctor to prove why this treatment is necessary by providing test results and notes to support the medical decision. So this process in the Cayman Islands, and I'm not making this up, has caught some very imaginative abuses, such as massages, like general massages, being billed as physiotherapy sessions, cosmetic procedures that aren't covered, and they're not medically necessary, being slid into the bill for an actual covered procedure, and freaks of nature, like pregnant men. Yes, ladies and gentlemen, that is what we call insurance fraud. So we use the pre-authorization process to prevent the conflict, prevent the trip to the courthouse, and to prevent the overtaxing of our regulators. Our Health Insurance Commission and our Health Practice Commission are incredibly under-resourced. And when I say that, can you imagine the amount of resource that you would need to be able to effectively police and regulate both the healthcare professional, and remember, healthcare is now incredibly diverse, and to moderate and to actually regulate the health insurance providers. And we have several, I think we have 9 on island now, 8. It would bankrupt the Ministry of Health. There's no way that they could hire all of that expertise. But they do a remarkable job with what they have. But our pre-authorization process is there to prevent the conflict from arising in the first place, rather than overburden the courts or the regulators. What you will also find is that in instances where a case management team does not have the resources in-house in order to properly adjudicate a claim or to assess a pre-authorization request, we still have our networks. And I can speak for our network, and I know that there are other insurers on the island that have massive networks such as ours, of over like 1 million providers in the United States and all over the world. So we actually can draw on those networks as backups and pull on the expertise within our networks and get expert opinions when we need them. But we've also had to evolve beyond just the defensive measures and the protection and the advocacy measures on behalf of the patient. We've also had to evolve with the times in the best interest of the patient. In the last 2 decades, as primary care and wellness and preventative care have become priorities in the evolution of the healthcare system, the insurer has also made the connection, and this usually happens with money people, like they catch it quickly, between the cost of healthcare and patient education and empowerment. We are very, very conscious of the company culture around wellness and the impact that that has had on that company's performance in claims in that year. The company, the HR manager is also very much on top of this information. They will know when their culture is poisoned, when you see absenteeism, people staying home sick, going to the doctor. So you're going to see the impact of company culture and the experience of your life on your wellness, and also on the bottom line, the cost of healthcare. So you'll see many of us are engaging, and if you're insured in Cayman, and you should be, I mean, all of us are required to have insurance, you will know that your health insurer probably provides a wellness program in some variety. These wellness programs are really designed to spark the interest of the insurance client in their own health. Almost all of our marketing dollars, and I think the majority of health insurers can say this, almost all of our marketing dollars are spent on health promotion in this country. But we've seen remarkable results. I myself have delivered premium reductions to experience-rated groups as a result of them taking on really robust wellness programs. I mean, I remember there was one group that we were working with for a 6-month program. It was an experiment for them. They had had several years of really high claims and really high premiums as a result. And they took on a program, it was really comprehensive. I mean, I've never seen another program like it. And within 6 months, their premiums were reduced by 4%. That's just 6 months of work, of everyone working together. But these are the roles that we play. But I come back to a few simple truths. And you remember the lenses that we talked about at the very beginning. We, the human beings, the human bodies, are the king of this jungle. We are all human beings playing a different role within this system. And the entire system is based on our agreements. But it pains me that we often forget the role that we play as the patient in our own health. And it's really tough to like see the overweight nurse struggling to breathe at the top of the stairs on her way to work. Or the physician that cannot go more than an hour without a smoke break. Or the government employee, the civil servant who used to be a track star and now doesn't own a pair of sneakers. And the insurer who drives themselves to drink on a Friday night, goes binge drinking every Friday night. Yeah, I hear them. They're in the room. You know yourselves. But we hide behind the roles that we play, forgetting that every single one of us in our own jungle is the patient. But it isn't all bad news. I'll just close with actually one very good news story that has actually set my entire team on fire. A story about a patient who decided that she was the queen of her own jungle, that she would take responsibility for the role she was playing in her own healthcare experience, and that she would be making her own agreements about how this would go. So she began as a normal member. I think at the time of this story, she was already in her 60s, paying a normal premium on a very fancy global access plan. I mean, the premium would have been somewhere in about $650 a month. And I know that sounds high, but this is a fancy program. She was our client, and we had an agreement. And then disaster struck. She got the big diagnosis that everyone's afraid of, and she began to go to treatment that would wreak havoc on her body. I remember when she started her treatment and how just down and worried and strained she looked, and she was really having a hard time with her treatments. And she was very much worried about her children, especially her youngest, who wasn't dealing with her prognosis, which wasn't good, very well. And I know the first few years were rough. Her claims told us a lot. And as a result, her premiums began to climb. You know, this is where we get claim money from. We get claim money from premium. We don't make money up and pull it out off of the tree. But we did our best to work to keep her claims low. So she started to seek care overseas, and she was actually assigned a case manager at the time. And at one point in time, she was paying something like $1,800 CI a month for premium. But mind you, our actuaries and our case managers behind the scenes worked very hard to keep it that low, okay? As a result of the discounts that we fought for, as a result of the creative rating methods that our actuaries came up with, she wasn't paying $5 grand a month as she would have been otherwise, or 10 grand a month if she had not gotten some of our network discounts. But this went on for a few years. $1,800 is a lot of money for someone who doesn't have it, and $10,000 is that much worse. But it went on for a few years, and all of a sudden we started to see some changes. And we've kept in touch with her constantly throughout the years. She made a decision to engage herself in her own experience of her own health. She got involved with so many things that we can't even pinpoint what made the difference. You know? She got involved in a group that studies and experiments with herbal treatments, in particular essential oils. I know my essential oils people are in the room. Lots of them, we love you. She also began to go to talks that were hosted by naturopaths on how the systems of the body work with certain plants. Invigorated by a growing sense of her well-being and learning more about her own body and the healing power of nature, she also relied very, very heavily on her faith. Got involved in her church, participated. I mean, she was already involved, but she upped the ante, not allowing anything to keep her out. And then, leaving no stone unturned, she started to research her diet. She did the research, and she decided that the best way forward would be for her to go on a plant-based diet. She committed, God bless her, to this diet, and redouble her efforts on getting well. Functions she thought she had lost forever, a sense of vitality she thought she would never be able to experience again, began to come back. And she's still not out of the woods, but she continued her treatment with her doctors as well. This was a compliant patient, not somebody who threw out Western medicine for all these other things, but combined all of the things, all of the resources that were available to her to enhance her experience of her own life. And all of these decisions paid off. We delivered a 50%, almost 50% reduction to this client this year. And it kind of gives me the chills, because you can imagine being ill and not being able to work as actively as you did, and then throwing yourself into this and seeing the return on your investment in yourself. Without patients like her, the work that we have expanded to offer and the wellness that we provide to companies, et cetera, none of that would ever work. Every insurer in this room that has created a wellness package has set up for the event, the talk, the health check in certain companies, and no one shows up, right? Like all of us have experienced it, where we will put it there, invite you to drink, and nothing happens. Patient empowerment is an inside job. But as long as we have patients such as this particular lady, who is king of their jungle, queen of their jungle, and willing to pay their role, we will continue to show up, and we will continue to offer these things in the hopes that everyone one day starts to participate on this level. But before I take any questions, I'd love to share with you a video of one of the things that we've been up to recently in adding and expanding what we offer to our clients.
I'm farmer Clarence McLaughlin, and I do farming here in the Cayman Islands full-time. That's my career. As you can see in our greenhouse, we got just about everything growing here. So we are a big producer of mangoes, local mangoes, coconuts, tomatoes, avocados, and we do a vast range of different types of vegetables. It's local, healthy produce. In partnership with Generali, we do a lot of these pop-up markets. We take these crates with, say, tomatoes, with lettuce, with mixed greens, with arugula, you know, that type of stuff. But I basically do a market. So everybody has, say, like an hour. They chat with me about what I do, how I grow the stuff, and they buy also their fruits and vegetables. I'm offering people a chance to eat healthy food, and they really look forward to it, and it has really worked really, really well. They just think it's wonderful. You are what you eat. A healthy lifestyle, it pays off in the long run. It catches up with you when you're least expecting it, or when you don't want it to catch up with you. Okay? When you're young and healthy and strong, it's okay. But when you're 75 or 80 years old, it's not okay. Okay? I'm sorry to say that, but it's the truth.
Time for questions? We do have a few minutes for a couple of questions. If anybody's got some questions, you'll need to put your hand up so we can bring you a microphone, because we are recording it. Do you have any questions? Are we too close to lunch? Oh, we've got a couple of questions. Got one in the back. Shireen's coming.
Okay. Thank you, Annikki, for that interesting talk. There's something I want to maybe say, and maybe you can correct me if I'm wrong, because I feel somehow that there is a gap in the process of our evolving healthcare system. Health insurers are becoming more and more important to the functioning of providers and for the well-being of insurers. One of the challenges that I have had as a provider is the way the health insurance companies have engaged with us as individual providers. And that is where I think the gap is. I think a lot of the changes that have taken place without us being educated concerning what has been happening. So for example, I don't know if a health insurer functions as a co-op or an investment company. And I think those kind of things help us. Let me give an example, because my question comes at the end of it. Pharmaceutical companies send out sales reps. In fact, that's marketing, eh? And the sales reps not just reach out to those who are going to be buying their products, but those who are going to be dispensing their products. And so my question is, because I know that all of this is going to develop further, is that on the plan as this whole thing of managing health continues? Do health insurers have a plan to educate providers and connect with providers one-on-one so that we understand more of what you do?
That's an excellent question, and I would agree with you that it is one of the gaps in our current ecosystem. And what you'll find is that each one of the players who is playing a role in this ecosystem is so dedicated to their own development that sometimes we kind of lose sight of who's beside us. But I think it's also one of the things that health insurers are paying a lot of attention to currently. The majority of health insurers in Cayman do have provider relations teams that meet with providers on a regular basis and sit with them and walk them through the processes, answer their questions. They do site visits. I think one of the things that you're going to find, though, is that one of the challenges that we have met as insurers has been being able to communicate with the provider community in a cohesive way. So for instance, I'll tell you what I'm looking for. When something arises in the Cayman Islands around health insurance, it's very easy to get all of the health insurers in one room. We meet on a monthly basis to discuss challenges within the industry, challenges as it relates to changes in regulation, et cetera. However, it's very difficult to do so with the provider community. One of the things that we at Generali have been working very hard on recently have been to reach out to every single provider in the community. I think, this may be a little different from a provider who is practicing privately from one who is practicing out of the HSA. So for instance, we will interact with the HSA as a body, but not necessarily with every single provider. However, with the private providers, we will sit down in your office, we will sit down in your clinic. Every single one of you will have a visit within a year. But that's the intention, and that has been our mission. And I think we've been going very far towards completing that for 2018. If there is a gap that you are aware of, one of the things that we would invite every provider in the room to do is to reach out to the health insurer and have that conversation. And in absence of being able to do that with individual health insurers, reach out to the Health Insurance Standing Committee, and you can meet with all of us at once. I hope that answers your question. Another question.
One other question. Is there another question? Yes. We need a microphone down here, Shireen, please.
Thank you. This question is probably for Ms. Ahern, especially based on the presenters earlier that was speaking on mental illness in children, and especially the statistics that was shared by Dr. Sally and Dr. Lockhart, and even from the presenters on the panel discussion. I was wondering whether there is any thought process into increasing wellness services or mental health outpatient services benefits.
Okay, so I guess I'll take that.
Yeah, you can.
Okay. So back a few years ago, 2014, the ministry partnered with the World Health Organization and the Pan American Health Organization, and we did the WHO AIMS survey, which is an assessment instrument looking at our mental health system and services. And the big gaps that that survey identified for us at the time were outpatient services for children and youth, and inpatient long-term care for chronically ill adults. And so the ministry has been working very hard to progress the mental health facility, as we talked about earlier this morning, for the adult population. And I know that with the local providers in the private sector as well as the HSA, that we've been seeing an increase over time with the availability of services here. I mean, you heard the one panel member, doctor, that said that it wasn't until she moved here from the UK that she was able to get the services that she needed for her son. So I think that although we could still have a long way to go to be where we'd like to be optimally, I think we are making progress and we're heading in the right direction. So I do think that we're seeing that increasingly. And it is in answer to what we're seeing as an increasing need as well, as we heard. There is an increasing need for that. Okay, so we're going to wrap that up. If I can get a round of applause for Annikki, please. We do have the mic. We have a very small token of our appreciation. Annikki, thank you very much. I'm sure we're all going to go away and think about how to be the queen of our own jungle, or the king, as the case may be. Thank you very much. Some really good food for thought. Thank you. Thank you. Okay, so we've reached that critical juncture in the day, lunch. We're going to take a break for lunch. I want you to make sure that you thank our sponsors. If you see some people in black healthcare conference shirts, those are volunteers, and I need you to thank them as well, because they work very hard to make this happen. Get your flu shot, sign up for the patient portal, maybe donate some blood after you've had something to eat. Don't forget to enter the draw at the Pinnacle Media booth, and we'll see you back here at 2 o'clock for our next speaker, looking at advances in digital technology empowering health. Thank you all very much. We'll see you back here at 2.